Thank you very much for that introduction. And thank you to you all for being here and for giving up 2.5 days of your time to be here. I always say I'm so happy to be talking about patient-oriented research whenever I get the chance to, but particularly when it's with a group that's so enthusiastic about making a change and really impacting that research side of things as well. So thank you very much for being here. I should probably introduce myself. My name is Zara Monferdi, and I'm the Strategy for Patient-Oriented Research Program Facilitator at the Ottawa Method Centre, as Simon just said. That is a mouthful, and essentially it just means that I study patient-oriented research and how to engage patients in research in my job. I'm particularly delighted to be here today because I'm co-presenting with a really good friend and colleague of mine, Elise Maybe, and she is a patient partner on at least 6 research projects just now. I say at least 6 because she is wildly modest and is likely doing a lot more work than that. And she's also the co-founder of PAN, the Patients Advisors Network, which is an awesome organization that does a lot of good work in supporting patients in their partnership endeavors. So that's who we are. We also met about a year ago working on CIHR, so the Canadian Institutes for Health Research, foundational curriculum in patient-oriented research, and since then we've done a lot of great work together, and whenever I get the chance to invite Elise to present with me, I definitely take her up on that. So that's who we are. Today we'll be talking to you about patient-oriented research. Our goals for the session, we're hoping that by the end of the session, you'll all leave knowing a little bit more about what patient-oriented research is, and we're also going to talk about how engaging and partnering with patients can actually benefit both the research and the practice side of things. And then lastly, Elise is going to give some practical examples from the work that she's done as a patient engaged in research. So our agenda is going to look like this. Really quickly, so we're going to talk about patient-oriented research, define some key terms, and talk about why we need to do it. And then likewise, we'll talk about that patient engagement piece, what that is, and why we need to be doing that in our research as well. And Elise will talk about some examples and also give her key to success, so something to stay tuned for. So patient-oriented research. I wanted to start by tackling that word, who is a patient, because I will be using the term patient throughout this presentation, though I'm very cognizant of the fact that you all might be using different terms to refer to something very similar to what I'm talking about. So does anyone want to shout out what is typically used in the mental health community to refer to something like a patient, or to substitute that word? Does anyone? Client's one that I heard yesterday night. Anyone else? Yeah.
Service user.
Service user. Yeah. Definitely. Consumer. That's a really interesting one. It sort of evokes that feeling of a supply and demand model in healthcare, which people tend to want to stay away from, but it's a very true way to think about the interaction between patients and their healthcare providers. I'm also thinking about person with lived experience. We've been hearing that quite often. And I'm seeing some nods too, so that's something that you're all comfortable with. So like I say, I will be saying patient just because of the organization that I work for. Like I say, I work for the Strategy for Patient-Oriented Research. And so they have provided a definition for patient, which is what's on the slide just now. So individuals with that personal experience, and it also includes their informal caregivers, so people like their family and their friends. So it's an all-encompassing term. However, in saying that, if you feel more comfortable using, service user or person with lived experience, then absolutely feel free to substitute as you see fit. I just wanted to make that distinction clear just now. So now that we've tackled patient, what is this patient-oriented research thing? Well, it's defined as a continuum of research that engages patients as partners. So we will get back to that patient engagement piece. It also focuses on patient-identified priorities in order to improve patient outcomes. So it's putting the patient at the center to make sure that what they identify as important is where we direct our research. It's also conducted by multidisciplinary teams in partnership with the relevant stakeholders. That's a really important point because when we say multidisciplinary, we're referring to obviously the patient and the researcher. But at the table, we also need to be including policymakers, key decision makers, healthcare providers, people from industry, because all of those different perspectives are really important in making sure that the research we're conducting is in areas of, actual priority. And lastly, it aims to apply the knowledge generated to improve the health system. So in a way, all research, should try to do that. But this is really about integrating that research into the policy and the practice that we receive as patients.
So I'm going to jump up and down like a traffic box here. I just want to say that POR, or patient-oriented research, is all of these things. It's not a sort of a la carte menu. It needs to be all of those things, and it needs to hit all of those points.
Oh, absolutely. That's a really good point.
Yeah.
And to that point, the reason why patient-oriented research is different from what we usually conceptualize as research is because we're introducing this new role for patients in health research. What we need to recognize is that patients are experts. And I'll say that again because I don't think we can say enough. Patients, service users, people with lived experience, however you want to say it, are experts. They have distinct, unique, and special experiences and perspectives that they have from living with a condition, an illness, a disease, every single day. And they'll also have distinct perspectives of receiving different kinds of treatments, of their role in the health system, which will be very different from someone who's professionally involved in the health system. So what patient-oriented research is about is encouraging the patients to tell their stories and then harnessing those stories to identify new themes in research so that the research is guided in such a way that the results are more aligned with those patient priorities.
Okay, so the point here is that all of our stakeholders are relevant. All of them are equal in their own expertise. And this is, having patients on deck is an opportunity, as we've been experiencing today, to hear people's lived experience. And that sort of flushes out what the research is all about in the first place. So it's extraordinarily important.
So I'd like to run a quick activity just now to gauge our understanding of exactly what patient-oriented research is. It'll be really quick. I'll read out the scenario and then I'll just ask by a show of hands for you to tell me if you think it is an example of patient-oriented research or if you don't think it is. So here it comes. A research team is looking to determine patient preferences and implementing an online management tool for obesity. Patients will go in and they'll track their meals and their exercise, and then their physicians will be able to go in and also track that in tandem as well. So that's the project idea. In order to do this, they're going to recruit patients through their primary care, so through their physician. The research team is going to conduct interviews first with the patients to talk to them about their preferences and even using the online tool. And then after the patients have used the tool for about a month, they'll distribute surveys and they'll talk to them about, what went well, did their preferences change, things like that. So is this an example of patient-oriented research? Who thinks yes? Okay, and who thinks no? All right, so I thought I was going to catch out a few more of you than that. You're all already experts, that's wonderful. Indeed, it's not an example of patient-oriented research. Because patient-oriented research is about making sure that the relevant stakeholders are involved in the planning and the conduct of research. It's not always necessary nor feasible to make sure that patients be involved straight away from the beginning and then in each instance or each part of the research project from there on out, though that is a standard that we should really strive for in every instance. In this example, what was the involvement of the patients? They were essentially providing the data, they were the providers of data, they were the subjects of the research. Had this been designed, had the research study itself been designed with patients, had patients been involved in conducting some of the interviews with their peers, or had they received some of that interview data or that survey data and provided their perspective on